Welcome to the Health Wrap. I'm Carolyn Sawyer.
And I'm Carla Winfrey. How are you doing, Carolyn?
Don't ask. You know what I just heard, and that was the testimony from our, I guess everyone's calling him like the ultimate medical person, Dr. Fauci, who was saying, this can go on and on and on. This is not ending. This is just not ending. So, we all hope and pray we'll stop talking about COVID sometime soon. But with that thought in mind, so many people are changing the way that they do business, beginning with, one of my daily rituals, Google. You Google
Yes,
too. Google.
yes.
Google says they're becoming the first major company to formally extend work from home until the summer of 2021. That's next year, y'all. What's
Right.
that?
So, well, and they sent out an email to all of the Google employees across the world about this. So they're going to extend it until January. And they said this doesn't mean that they're going to, because some people are questioning, like, well, do they really need to be in the building? No, that doesn't mean that. They're just concerned about their employees. And one thing they did say, Carolyn, was they were also concerned about parents who have children that will be at home having to do their work virtually. So they're concerned about that, about COVID and everything that brings with it.
It's just, I mean, and so many mixed messages. This is all in a week of what the NBA went back to playing. Last week it was baseball. I mean, and again, one of the things I keep hearing so many of the professionals say, and that is there is no national plan for managing this. It's hard to do anything without a plan. You don't get in your car and just drive, although some people do,
Well,
but you kind of want to know where you're going, right? You want to know which interstate's going to take you to Atlanta, which one's going to get you back. Come on, you got to have a plan, people.
well, you know what, and a lot of you talking about planning. Of course, schools are planning, churches are planning, and in fact, we're going to have a pastor a little later coming on who's actually a COVID survivor. And businesses are planning, but it seems like people don't have their personal individual plan for some people.
You need a personal plan, a family plan. This was something I got in the mail this week. I guess it tells you a lot about where I spend some time. One of my favorite stores. But yeah, they're now sending out instructions starting July 30th, which was earlier this week. You will have to wear your face mask. And you got to be 6 feet apart. Now, I'm a little frustrated because my attitude is a lot of these companies could have sent this out 6 months ago, or certainly 3 or 4 months ago when we started all having these conversations about this. I'm a little disappointed, not just in TJ Maxx, but some others in terms of why now. I think Walmart was another one I'm seeing their commercial on, but why not sooner?
I guess it's just like a shock to them now that so many people are contracting infection and passing away in the whole United States. It's so funny. One day the whole United States is red, another day half. You go in when some of the cities say, well, we're going to step back, it dies down some, and then they come back right out. And it's like you said, we need a whole national plan on what to do. What I like about this graphic is that these symbols, anyone can understand them, any language, any age. So I do commend them for doing that.
And that is so important because you and I both know we continue to hear that our Latinx brothers and sisters are really taking a hit, particularly in the Southwest. You used to work in Texas. Here's a story that popped up this week, which I thought was interesting. Right here in my backyard, I guess it's down the road, Savannah. This is a Georgia news anchor, and she has agreed to take the first shot in the U.S. phase 3 trials of a COVID vaccine. Not sure if she's actually getting the vaccine or a placebo. That's how these types of research projects work. I know we reached out to her. If she's watching or any of her friends are watching, tell her we're trying to reach her. We want to talk to her. I would like to know a little bit more. I mean, would you have done a trial, Carla?
No, I would not have. And the reason why is, I'm looking at, I want to see what happens first. And when we talked to our expert who's been in infectious disease for 40 years, Dr. Hildreth, the president of Meharry, he said that it was going to take a while, that it would probably take even up to 4 years until they find the vaccine, like we have for so many things that will just totally eliminate it. But I'm sure because they're working on some things over at Meharry, just like a lot of other medical institutions and universities and other companies that will slow down and keep it from spreading.
Well, I'm just going to say I'm not a shot girl, so I'm just not the one. But I will tell you what I did hear this week, and you want to pay attention to. That is that Fauci and some others are urging people to get a flu shot this season. And so if you've been on the fence on that in previous years, you might want to do it early, kind of like vote early. So you're not standing in line. You don't get to your drugstore and they say they don't have any more of the vaccine. It's coming in. Do it early. I think that's some pretty sound advice, particularly if you have.
But good for her. I mean, she's brave to do that.
Oh, absolutely. We'll get to her. I'm again, if you're watching and you know her, call her, tell her I'm trying to get to her, tell her to call me so we could talk. I want to hear. She said, I thought it was interesting that she was hoping that by being part of the process, it could eliminate some of her personal fears. And that's what we're doing every week here, trying to give facts to calm folks, to calm those, give facts. Now this one, there's a reason there's a big old fat red X that Hillary came up with on top of this picture, because these folks in these white lab coats, where can you, I guess you can just go buy a coat right anywhere and put one on and talk about COVID. Is that it? Come on, people. I mean, and then, I even had somebody call me and say, oh, this was a doctor. He is a doctor who called me and said, she's well spoken.
What does that have to do with anything?
The information is wrong. Who cares how well you speak the information? It's wrong. These folks, if you missed the story, good. But I have to tell you, because if you didn't or you saw it and you're confused, let's be clear here. All this foolishness they were talking about, just don't press pause, rewind, go to another video. Okay. Where it's like dragging back the debate as to whether or not you should be trying a drug that has not been proven to actually control or to rid the body of COVID. That's the bottom line. So, I mean, if it's not proven, then why are we going to keep having this debate about it, right?
That's why we have the FDA. And that's why we have other measures that drugs have to go through to show that they are proven and that we are able to take them.
And that's why we have common sense, because when I started hearing, not this particular doctor, although I understand from our producer that she actually got fired, she was terminated because of this video. But sister girl over there to the right in the photograph, man, they started talking about her bio and her background and her beliefs. And I was like, oh no, too much for me. So again, this is where we can't urge you enough. I mean, Carla and I aren't doctors either. We're just pulling out what we think you need to pay attention to. But the reality is this: God gave each and every one of us some good common sense. Okay. It's not as common as it used to be. Everybody doesn't have it. But if you don't find somebody who does, and when you see a video like this where we've already been telling folks this drug is not working, people,
right,
leave it alone. Next. Beat that horse, right? Okay.
So
here's one of our Georgia friends, Mr. Herbie Kane. Mr. Kane. Well, what can I tell you? Did you know he was a Morehouse man?
Yes, I did know that. And interesting enough, this is just a little fact. His father is the one. His father was like the driver for the founder of Coca-Cola, one of the heads of Coca-Cola, and that's how he got into the whole business by studying some of the things. But he was a businessman. We know that. We know that he was a former GOP presidential candidate, and he passed away at 74.
And we know a few more other things because we were journalists at one point, but we just don't stop right there, right? Okay. Here's the problem. And there's been a whole debate. You die and people debate it. He had been in the hospital about 4 weeks. He'd come down with COVID. And the timing on it was right after that big rally in Tulsa, where not a lot of people showed up, but Herman and a few other folks showed up. And they actually posted something on Twitter where they were sitting together as a group and everybody's smiling and nobody had any mask on, right? But as our producer pointed out to us, the doctors are saying they can't conclusively say that he contracted it at Trump's Tulsa rally. And I heard one of his colleagues say he's been really busy lately because he was about to start another radio show in about 2 weeks. He's on a radio show that I've heard, a syndicated show. I've heard. So he was about to launch another radio show. He had a book. He was on a book tour. And we all know what happens at book tours. A lot of people come
People
up to
all
you,
around you. Yes.
read on you. A lot of people want to touch you. So again, book tour and the whole
Traveling.
on a plane.
Traveling.
On a plane. Okay. We
Pre-existing
really,
conditions.
yeah.
Remember, he had cancer.
Yeah, he had battled cancer and he survived cancer, and now he's gone with COVID. So we really do want to lift his wife up and family, because I
Yes.
know this is a difficult time. But Herman leaves us a legacy of a couple things, and I think here in COVID, it's a lesson of wear the face mask, people, wear the mask.
Well, speaking of mask, our doctor, we call him like the top doc, Dr. Fauci. And so we asked questions. Well, it was an article that we saw that they ask all these questions to leading health professionals. And one of his questions was, are you willing to fly? What about bus, train, subway? Well, Dr. Fauci is 79 years old. He's a wise man, not only medically, but common sense. He's not getting on any plane. He's not flying. He talks about how people were sneezing and coughing. And then 3 days later, I've got something. So no chance, no metro, no public transportation. And he says, I'm in a high risk group and I do not want to play around.
Absolutely. I got wind of this article from my girlfriend, Pam. She was out on the West Coast and saw the Seattle Post-Intelligence, where your brother is. And they had done this interview with 5 of the top epidemiologists, one of them actually being Dr. Bell here in our state. So we'll keep sharing with you some of the comments. It was really interesting. It was a personal perspective for them on what would you do. And we're going to share that with you throughout the show today. And we'll have some more for you next week. There were 5 interviews that they conducted. We'll be back, though. We're coming back up in the second block. You mentioned we'll hear from a survivor.
Yes.
A lot of people have heard about what it looks like, or some of these interviews are showing you people on these ventilators, but it'll be nice and refreshing to hear from a survivor. So we'll be right back after these messages.
To help protect others from COVID-19, DHEC encourages everyone to wear a mask or cloth face covering when in public. Make sure your mask covers your nose and mouth, and you can breathe through it. Remember to clean your hands before and after putting on your mask, and try not to touch the mask or your face while wearing it. Don't use a mask on children under the age of 2, and don't use surgical masks needed by healthcare workers. Help stop the spread. Visit scdhec.gov/COVID-19.
So yes, we're still talking masks, and this could be our new normal, right?
Absolutely. It's a lot of times that you think about how long we're going to have to wear these masks. Well, we may have to wear them for a long time because we can just not get this under control. So, we just have to, speaking of the mask, there's Dr. Satcher.
Yeah, and that interview we were just alluding to in the Seattle Post-Intelligence, they asked him the question, when do you wear a mask? And guess what he said? All the time. Even when I'm in my office, I keep it on, since people are always coming in and out. And the only time I don't is when I'm at home. And that means you're close proximity to family members and people, your loved ones, and you know where they've been and you know what you've been exposed to. So again, we just want you to hear from the experts, and you can follow their lead, and you might do all right.
Right. And today we want to talk to someone who we want to celebrate, a survivor of, and this is one of our pastors from Georgia. And we have Pastor Johnny Porter. He is also a counselor and a PhD candidate right now. And he's from the Living Grace Life Church in Villa Rica. And welcome to the show.
Hi, Carla.
Reverend Porter, how are you doing?
Hey, guys. How are y'all? Pleasure to be here.
Well, we're glad to see you. We're glad that you are here with us still on this earth. I know when I first talked with you, you had told me how you had been the one when you, at the outset of COVID, telling other pastors, hey, we don't want to have service. Talk a little about that. Then we want to hear about your story.
Absolutely. I remember in the hospital, I was in the hospital in my room. I had only been there a day. And it was a Sunday. I was admitted on a Saturday, and so Sunday morning, of course, I asked my wife to bring my computer stuff to the hospital, but all I had was my phone. And so, of course, my to-do thing, getting up in the morning was to go to Facebook to see what's going on in the world. What did I miss while I was asleep? And of course, all kinds of 8 a.m. services are going on, and all kinds of things are happening and I'm seeing people laying hands on folks, and I see pastors praying over people with the microphones, and I could actually see the spray from their mouths coming out, and it just sent me in a panic mode as a pastor. And never been a germaphobe, but I'm a healthcare worker working in hospice, and I am very familiar with how you are to handle germs and things like that. And working in a hospital as well, I know that you're supposed to have certain PPE equipment, to be prepared. And of course, just having contracted the virus myself, I was literally in panic for the people because I knew something that they did not. And I was in a hospital and I needed to let them know, hey guys, you don't know anybody personally, but you may know me. Here's an example. This is real. Please stop what you're doing right now. And guys, reconsider. Please don't do this. And so I felt like I needed to put something out. And so from my hospital room, I sent a message. I took a selfie and I sent the message out. And man, my feed just blew up. I've never had so many responses in my life.
What do you say to people, though, Pastor, when they say, if it's God's will, it'll be God's will, I'm going to do what
we hear that all the time.
I heard it from a pastor.
I think that is the most irresponsible thing in the world. It's just like God will provide, God will take care of me. That's the same thing we'll say when we need a GoFundMe because we didn't prepare for life insurance for an event. And we can't live life as if something will, may happen. It will happen. It's always a matter of time.
How did you know that you had contracted the virus?
Watching the news, I remember that they reported this months in advance. So I was very familiar with that. And in hospice, we're always mindful that we're around. And so we are always wearing masks or practicing that type of safety protocols for our patients because we're not afraid of them. We want to protect them from us because we go visit from one home to the other, just like we would visit a one patient room to the next. So we're very careful about washing our hands, using those type of things. Well, I remember a week before I got admitted to the hospital, it was a week and 3 days to be exact, I was sick. I had recently went and got a flu shot. And I assumed that I was just sick from the flu shot because that's my normal response to a flu shot. And it's very possible the flu could have saved my life in this situation. And so trying to get access to one of the facilities that we provide care for, which is the Cancer Treatment Center of America, I went to go get the flu shot so that I could be that provider for some of my patients, which is a protocol that they have. And so I just assumed that I was sick from the flu. And I remember being extremely weak and all those type of things, but I felt like something wasn't right. And I immediately started distancing myself from my family, from my wife and children, just to make sure that they were safe. And that's just a normal thing because, we are around sick patients all the time. So I knew something wasn't right, but I did not know I had COVID-19 until I was admitted to the hospital. And that sent me into a whole nother panic.
What about emotionally? I mean, I know you're a man of faith, but tell us what the process was walking through this emotionally.
Emotionally, to be totally honest with you, I'm going to be honest with you. My faith really was challenged. I have to be honest with you. It was extremely challenged. As a pastor, as a chaplain, as a man of God, as a counselor, therapist, I knew the right things to say to myself. But the reality had a louder mic. It was louder. The voice was louder. I was concerned about leaving my wife, leaving my children. I was concerned about life unfinished, things that I wanted to do, but I was extremely weak. I haven't been that weak before. This excessive coughing, my chest hurt, just extreme fatigue. And when it was confirmed that it was COVID-19, I literally felt like I was looking death in the face. And my beliefs really, I have to say, I struggled for it to help me. It was hard to really believe all the things that I knew, all the things that I knew to be true, all those things I believed to be true and was telling myself and convincing myself. It was a battle to believe. Honestly, it was a battle to trust that God was there. And ultimately, I knew God was there, but boy, I had to work, and I truly had to work to convince myself God's got this. God's got this. And I hear people say that all the time, but looking death in the face like that, it really, really challenged me. And so now when I hear somebody say, I know him as a healer, man, y'all gonna make me shout. When I hear people say, I know him as a healer, I truly get that. But also I get what it means in the Bible when you read the story of a leper who feels unclean and feels like they have to yell, unclean, unclean, I'm coming close to you. I understand all of that. And so psychologically, having COVID-19, especially as a survivor, you even get the survivor's guilt, but there is this whole reality that your world has changed. You don't feel, something's off. Something just doesn't feel right. And of course, allergies comes with that as well. And I remember having allergies as a result of having COVID-19, and that literally sent me in a panic, almost as if I had PTSD. It was scary. If you can only imagine, a sneeze or a cough or something like that makes you feel like, oh no, it's back.
Okay. Well, I want to thank you. I know you want to provide hope for other people who are going through this, and we appreciate you giving basically your testimony so people will be hopeful and know.
Absolutely.
Yes.
Yeah, absolutely.
Right.
There is a lot of hope there. So, I tell people all the time, real quick, guys, believe, trust that it's going to be okay. Ultimately, this is God's doing. And we know that God cares and loves us, and he will see you through. And so don't worry. It's going to be all right.
Right. Thank you, Reverend Porter, for joining us.
Thank you.
My pleasure. Thank you for having me.
Well, we're talking about survival, and we've got one couple that actually survived cancer and COVID, and it's a great story we want you to check out.
In any marriage, you can have some squabbles and stuff.
They said the vows: better, worse, richer, poor, sickness, health. But the Beechams made one more promise.
Long life and happiness. We're going to love happily ever after.
Their anniversary was approaching when Robert Beecham started feeling sick.
Shortness of breath, loss of appetite, smell and taste, totally gone. And then the cough.
When that dry cough became severe congestion.
And it was like I was drowning.
Their son took him to the hospital.
When I left home and I didn't tell my wife, I prayed and made peace with God and told him I was ready to come home.
The Beechams know Dallas's Parkland Hospital better than they'd like. At age 65, Robert is a 2-time stroke survivor.
But this was different. When they took me to that 3rd floor and
The 3rd floor houses Parkland's main COVID care unit.
You hear the sounds of grown people, moaning and coughing. It's just devastating to hear all of that.
With visitors banned, Robert fought alone. Janice did too.
I was getting ready to have my first chemo treatment, and I got a text message: your husband has COVID. And I felt so helpless. And I'm like, I gotta get to him. I need to be there because I need him to know that I'm there. And then I started thinking, what if I have it too?
Janice's cancer made Robert determined to get well and get out. As he slowly improved, one particular Parkland doctor took a particular interest in getting him home.
He said, Mr. Beecham, if you were home, what would that look like?
But the cancer complicated things.
I say I would fire up my grill and make us a couple of steaks with baked potato. I was just laying it out. He said, how's your floor plan of your house?
The doctor drew up a plan to keep the couple apart.
And he said, I want you to be honest with me, to tell me if you would be able to do that or not.
The Beechams spent their 46th anniversary in quarantine.
We've been married 46 years.
Together.
And
46 years, 2 months, and 15 days.
Janice found out she had COVID right before her husband came home from the hospital. Somehow, her symptoms remained relatively mild.
I didn't care about being sick at that time. I was too concerned about him.
They believe being home together helped them heal.
I never had a chance to shake his hand.
And they heap praise on that one doctor.
This is going to sound kind of political because I intended to. That's how you make America great. I've never seen him without the shield, the plastic shield. I've never seen his face.
And
here's the face.
He's helped me more than I think I've helped him.
Dr. Sayatak Nayak worked hard to get Robert home because it was his first COVID patient to go home. When Robert left Parkland, he left with his doctor's personal cell phone number.
he called me on his wedding anniversary. My wife was in the car, and he was, just, expressing his gratitude and his heartfelt appreciation for all the work we've done. And, it brought tears to our eyes. And this is why we do what we do. We bring families back together.
They still talk and text, and Nyack pictures this face
I'm still able to get out here and do what I do best.
when his other patients don't make it home.
I would tell him every night when we talk, come back home to me.
That solemn vow of long life and happiness.
He came home.
It hasn't been broken yet. In DeSoto, I'm Teresa Woodard.
Wow, that is just a beautiful story from WFAA in Dallas.
That is how we make America great again. Okay, health equity, people working together, listening to your patients, understanding cultural connections, and honey, understanding 42 years of love. What a great thing.
Yes, and we will be right back right after this.
Hi, my name is Chef Gabby. No mask is a recipe for disaster. Gabby, be your own superhero. Mask up!
Make sure y'all mask up out there and stay safe, and check out my music, Missing Me, and all my other music on all platforms, 615 exclusive.
It's so important to keep your mask on right now. Food is a great substance, and it'll definitely sustain you, but it'll be all for nothing if you get sick during this pandemic, because you won't taste it anyway, from what I've heard from the COVID symptoms. So definitely want to wear your mask. Although I don't have mine on right now, it's just so you can hear me. I guarantee you, everywhere I go, I'm going to keep this mask on, and wear your mask and be safe.
That's the message of this afternoon. Wear the mask so you can be safe. We've continued with these wonderful quotes, and we invite you to look up this article, do a Google search. This is where they asked Dr. Fauci if he actually has people over his home for dinners. And so it sounds like they're still socializing. They just don't have, they have different things that they do, individual containers, they keep the social distance. So they're doing a lot of things to ensure that everyone is safe. And then I loved how he said, we also do this outside. If we can't do it outside, we just don't have the party. If it's going to rain, we just cancel it. So be ready to make those concessions. I think as we're moving forward, we're going to all have to make those kinds of adjustments.
Absolutely.
And Dr. Thatcher, he talked about grocery shopping. Same thing. You could see he wears the mask and does the hand washing thing, as he calls it. But he said he's compulsive about it. You almost have to be compulsive.
Absolutely. Because if you're not, you're going to endanger yourself.
Absolutely. So we've gotten some great advice today, a show full of advice, and we hope that it's something that you can use with your family and use to take care and keep yourself safe.
And Tennessee State University in Nashville, congratulations. They are having their first virtual graduation, 700 graduates. Among those 700 graduates, we have a student, Celine Bignall, who has taken 17 years to get her doctorate. And she says she credits it to grit. Congratulations.
All right. Congratulations to her as well. Well, I think that's, do we have anything else? Have we covered everything in the show?
Well, we had one little thing left about some good news about a little boy who had a birthday, and he turned 7 years old, and we're going to take a look and see what surprise he got.
Great story. Great story.
Yes.
Well, I think that's a wrap
That's
for this
it.
week. Yep. We thank you for joining us for the Health Wrap. Have a great afternoon.